Basically, as you already know, those of you who were taking classes, remove from chatting. Those of you who are already taking classes and they know that we have been covering this most important, one of the most important topic so far that we have covered. And this topic is basically maternal and child health part 5. And this basically final part when I started this topic way back in August, something like, yeah, we started that in August 2024, maybe. So I didn't know that maybe I will be making 5 parts, but basically, because of the maternal and child health included in this widespread topic, I had to break down this most important topic into 5 different chunks, and today is our final part. And first of all, we studied about the pre-pregnancy time, the times when a female gets pregnant. Then we studied about the childbirthing process. Then we talked about the aftercare of the childbirth, the lady aftercare of the lady who gone through the childbirth process. Then we started talking about the newborns. Then we started talking about the infants. And now we have moved on towards the toddlers. So basically, that will be the final part because toddler phase is the considered the most important phase after infancy. There are many new things going on in the physical and emotional development of the child, and there are many new things related to the mental development of the child, and we have to understand these aspects as well. And one more thing, I have tried to squeeze my class today so that I can take at least to 20 to 25 minutes of your questions, because I think there is a deficiency and I owe this responsibility to answer all of your questions, at least from the last 2 classes where there was so haphazard ending, and I felt bad for not being able to answer all of your questions due to time shortages. So without wasting even a single second, and with the permission of Dr. Welchin, I'm gonna start now. Should I start? My voice clear? Everything clear?
Everything is fine on our end. I would just ask you to, if you don't mind, hit F5 on
Yeah,
your
I
computer.
okay. I am hitting. I am.
All right.
Okay, everything okay now?
Everything is super fine. Thank you.
Thank you, sir. So, today's topic of discussion is maternal and child health, final part, or part 5, care and well-being of the toddlers. So, all of you already know me. I'm Dr. Omer Farooq. I'm bachelor in medicine and bachelor in surgery, resident orthopedic surgeon, practicing in a high-flow teaching hospital here in Rawalpindi Medical University, Pakistan. So, learning objectives for our today's class is introduction, then basic definitions, brief summary of previous class, then promotion of healthy and safe habits, injury prevention in toddlers, nutrition of toddlers, promotion of constructive family relations and parental health, common developmental concerns in toddlers. So these are the learning objectives for our today's class. So basically, we have to understand that how can we promote healthy and safe habits in our kids belonging to this age class. Then we have to talk about injury prevention. Then we will talk about nutrition of the toddlers, then promotion of constructive family relations and preventive parental health. We will talk about how a family environment should be presented to the child. Then we will talk about common developmental concerns in toddlers. So, introduction. Well being isn't just for grown ups. Physical, mental, emotional, and social health are all equally important and contribute to our overall well being. It is important that parents, educators, and caregivers foster all four in children from an early age. Adults can help improve children's well being and foster their connection to their own health and well being by being good role models for children and helping them develop positive thinking and behavior patterns. These vital skills can help children respond to stressors and prioritize their health throughout their lifetimes. Ensuring and promoting the health and well being of the toddler and preschooler is an important goal for all communities, since factors that result in poor health outcomes for children can lead to health concerns in adulthood. So, if a child's health, if a child's mental health, if a child's physical health, if a child's emotional health is ignored in these prime years of the first 3 years of their life, then it will have devastating consequences till the end of their lives. Their personality will be destroyed, their physical health will be destroyed, their brain growth will be distorted, their bone growth will be distorted, their immunity will be so weak, and everything whatever you can say the first 3 years, especially first 3 years of a child's life, are extremely important in for the physical, mental, and emotional well-being. Health promotion focuses on improving and protecting the health of different populations and communities, including children and their families. Health promotion programs aim to reduce health disparities and improve health outcomes in these communities. Basic definitions. So, neonate, a newborn infant or a neonate is a child under 28 days of age. During these first 28 days of life, child is at highest risk of dying. The neonatal reflexes are newborn reflexes. Newborn reflexes. They are your baby's involuntary muscle responses to stimulation. Certain actions or sensations produce specific muscle reactions. That means your baby isn't controlling the responses. They are happening automatically without your baby trying. So these are basically controlled by brain and spinal cord, and they develop primitively in the womb of the mother. A fetus is an unborn offspring that develops and grows inside the uterus of humans and other mammals. In humans, the fetal period begins at 9 weeks after fertilization of an egg by a sperm and ends at birth. Who is an infant? The term infant usually refers to a baby from birth to around 1 year of age. You may also use the term baby during this time. So basically, from birth to 1 year, or from 28th day of life to 1 year, you call that child an infant. And then toddler, a young child who is between 1 and 3 years of age, is called a toddler. Whether or not they are officially walking or toddling yet, the word is derived from to toddle, which means to walk unsteadily like a child of this age. So basically, a toddler is a child who is beginning to walk or who is learning to walk. By definition, by the words of the definition, but if you talk about the age bracket, then they are between 1 and 3 years of age. And a preschooler is a child who is aged between 3 to 5 years. A child aged 3 to 5 years is called a preschooler. And brief summary of previous class. In previous class, we understood the concepts of common neonatal problems. We discussed common neonatal problems in the class prior to our previous class as well. So there were some neonatal problems that we couldn't discuss in the second last class. So we continue to discuss those neonatal problems in our previous class as well. Then we talked about infection control, diaper care, circumcision care of the newborn. We also talked about bathing and skin care of the newborn. Then breast milk, formula milk preparation and storage were also discussed in detail, that how to prepare and how to store breast milk, formula milk. Then safe sleep environment for young kids was discussed in detail, that how to create a safe sleep environment for young kids. We also talked about choking prevention in infants and toddler, the things which can choke the babies, how to avoid those kind of items which may create choking in infants and toddlers. And we also talked about if a baby chokes, then what to do. And then vaccination guidelines for infant were also discussed in previous class. Now we come to our main topic for today, and that is care and well being of the toddlers. In this section, we will discuss all the details regarding care and well being of the toddlers. So, basically, this class is for the care, this class is for the discussion about the care of babies who are between 1 and 3 years of their life. So, the first 2 years in life, nutrition is very important. Preventing injuries is very, very important. Then, physical activity of the baby matters a lot. Then, oral health of the baby. Yeah, oral health is also very important because tooth decay has become increasingly devastating problem in past 30 to 40 years due to increase in white sugar, due to increase in use of chocolates, due to increase in use of candies, and etc etc. So basically oral health has been destroyed, the nutrition factor has been destroyed in many countries. Injuries are so common in young children's. Children fall off from bikes, children fall off from sofas, children fall off from bed, children suffocate, children usually burn themselves, children usually choke themselves, and there are in America the most common cause of death in young children is not malaria, is not respiratory tract infection, is not diarrhea, is basically injuries. Yes, in America, the most common cause of death in children aged less than 5 years is childhood injuries. Although this is not the case in entirely in the world, because there are so many deaths in countries like here in Pakistan, where kids die of diarrhea, where kids die of respiratory tract infections, where kids die of meningitis or preventable diseases. But as the preventable diseases have been controlled in America, so most of the deaths that occur in America are due to childhood injuries. So weaning starts around 6 months. Babies should not be given salty or sugary foods. Honey should not be given before age 1. Then unintentional injuries such as suffocation, choking, or falls in and around the home are a leading cause of preventable deaths for under 5 years of age. Then oral health is also important. Babies should be registered with the dentist as soon as the first teeth appear, and they should visit regularly. Like there should be a visit to the dentist after every 3 months. Then physical activity. Babies need to be active from birth. Tummy time encourages a baby to get moving and builds muscle strength. Promotion of healthy and safe habits. So this is our first topic for today. So wash your toddler's hands and your own hands frequently, especially after diaper changes and before eating. Clean your toddler's toys with soap and water. If your toddler is in childcare or in some daycare, provide personal items, for example blankets, cups, for individual use. Limit television time and video viewing to less than 1 hour per day. If you ask me, and in my household, we are a little bit more strict. We have limited that time to half hour per day on average. And if they haven't seen any screen in the last 3 to 4 days, then we permit them to watch more than 1 hour or max 2 hours a day. But that also happens if they haven't seen television or video in the last 3 to 4 days. So basically, be sure the programs are age appropriate and watch them with your toddler so that they can ask you questions about what is happening in that program, and you can explain everything. This way their learning increases exponentially. For example, if they are watching some program but they are unable to understand everything the program actor is doing, for example, if they are solving Rubik cubes or if they are doing some fun game, age appropriate for children who is 2 years old, but the child is unable to understand it completely, then there should be an adult who can explain that what is happening and what they are doing and what is the benefit of it, so that the child actually learns from it and it's not just a bare entertainment. Kids should be made to watch the video from the TV screen, and mobile phones should never be handed over to them in their hands. So basically, the problem starts when you start giving them mobile phones in their hands. This damages their brain so much. This damages their eyes so much. This gives them an addictive hit. So in my household, my kids know that they can never get mobile phone in their hands. Even if they take a mobile phone in their hands, we take it from them, and if they want to watch something, we make them sit at least 8 to 10 feet away from the television. We screencast our mobile phone with the television, and whatever is running on our mobile phone screen, it gets showed to the TV screen, and then they can watch it from 8 to 10 feet apart. And if they watch anything which is useful, which is informative, if I really want to show them, I show them from the TV screen. And this way they do not get addicted to taking the mobile phone in their hands and watching it from 6 inches apart, and like watching it with full attention, and damaging their brains and damaging their eyes and damaging their memory, damaging their attention and concentration, and so many levels. And it is so addictive. The screen is so addictive that real research there are real researches going on in the child psychology, that the addictive potential of the screen, whether it is equivalent to the addictive potential of some drugs like cocaine, etc. So basically, kids should be made to watch the videos from the TV screen while they're sitting 8 to 10 feet apart, and mobile phones should never be handed over to them in their hand. Expect your toddler to sleep through the night in their own bed. Reinforce good sleeping habits. Maintain a regular bedtime routine. In the case of the children, in the case of the toddlers, you make sure that their sleep is the most important thing. For example, if a toddler needs, for example, if we talk about a 2 year old or a 2.5-year-old kid, he or she needs 12 to 14 hours of sleep. You have to calculate whether he or she is getting at least 12 hours of sleep or not. Because if he's not getting 12 hours of sleep, his brain will start to get damaged. And that damage will be permanent on day-to-day basis. So basically, even if for adults, if we start to take less nap, and we come down to 5 hours a day, or 6 hours a day, which is very less, we need to increase to 6 to 7 hours of healthy sleep at least. Then for the kids of age under 3 years, it is at least 12 hours a day. So you have to make sure that they are taking at least 12 hours a day sleep, because their brain grows while they're sleeping. The growth of the brain and the growth of the nervous system takes place when a kid is sleeping. So expect your toddler to sleep through the night in their own bed, reinforce good sleeping habits, and maintain a regular bedtime routine. It shouldn't be like they are sleeping at 11 and someday they're sleeping at 9 and someday they're sleeping at 12 and someday they are not sleeping at all. And if parents are watching a movie, they are not caring about whether a kid is sleeping or not. So it shouldn't be like that. There should be a regular bedtime routine, and it should be clear to everyone that when a kid has to sleep, he has to sleep. There shouldn't be anything going on in the world so that kids are not able to sleep. So kids should be encouraged to be active. There should be a reading routine daily. You should tell them stories, or you should watch a book in front of them, or you should tell them stories which you read from books. Limit highly processed foods and drinks. Yes to water, no to soda. Limit screen use. eats lots of vegetables and fruits, you inculcate in them that they have to eat lots of fruits and vegetables in different forms. If they are not liking a vegetable in one form, you can give it in mashed form, you can give it in another form by mixing it with some other thing. You have to give them fruits and vegetables in one way or another. And this starts from early age. Practice having a growth mindset, then prioritize their sleep, take daily walks with them, practice good oral hygiene as well. By the age of 2 years, a regular physical activity routine should be made to maintain good activity levels in toddlers from the very beginning. It's no secret active kids are healthier, happier, and more intelligent individuals because exercise increases blood supply to the brain, and when blood supply increases to the brain due to forceful heat beating of the heart, the brain development fastens. So basically, they activities make the kids more intelligent. Kids who engage in play and exercise are also much more likely to do the same as adults. There is also a direct connection between movement and cognitive function. Kids should aim to be active for at least 90 minutes a day. Although me being a doctor, my wife being a doctor, we are unable to give time to our kids. And I feel pity about our kids because we are so busy in our routines. But yeah, we try to give them weekends, we try to give them uh, evening strolls, whatever we can do, we try to give them. But they are not active for at least 90 minutes a day. They are active for at least 30 minutes or 40 minutes a day. But still, these are the guidelines, and we should know what is recommended, even if we are not able to do it. So, injury prevention in toddlers, there is also a very important topic. Never place your toddler's safety seat in front seat of the vehicle with a passenger airbag. The back seat is the safest place for children of any age to ride. Get down on the floor and check for new hazards. Not hazards. Now that your toddler is walking, be sure that hot water heater thermostat is set to lower than 120 Fahrenheit, so that if they turn the hot water tap on, they do not burn themselves. Continue to test the water temperature with your wrist to make sure it is not hot. It is not hot before bathing or washing your toddler. Supervise your toddler constantly whenever she or he is near water, bathtub, play pool, buckets, toilets, etc. Do not expect young siblings to supervise your toddler. Yeah, you cannot expect an 8-year-old or 7-year-old to behave like an adult and take care of a toddler like an adult. Example, in the bathtub, house, or backyard, or whatever place. Continue to empty buckets, tubs, or small pools immediately after use. You do not leave water sources open with toddlers because they may fall head down in a bucket and they do not know how to get out of a bucket when they fall head down. Even a 3-year-old can suffocate to death, can drown to death in a bucket half full of water. Yeah, a 3-year-old can drown to death in a bucket half full of water if he or she falls head down. And we have seen this happen constantly. We have received such drowned babies. Their mothers were washing clothes, their mothers were doing some washing, and they put a half of bucket full of water and they went somewhere, and then when they came back, their toddler had drowned in a bucket half full of water head down, because a toddler cannot get up when they fall head down. They do not have the strength, they do not have the intelligence, and they do not know how to get out of that situation. So do not keep buckets even half full of water, even one third full of water. You do not do that with toddlers at home. You never do that. If you have buckets or anything full of water, then the toddlers should not be allowed to go there in any case. They should not be allowed to go there in any case. Even if you're using an open area or if a washing area or whatever the place is, if there is a bucket or if there is a tub full of water, the toddler should not be allowed to hang around there without adult supervision. Never ever. Children should be supervised by an adult whenever they are near water. Be sure that swimming pools in your community, apartment complex, or home have a four-sided fence with a self-closing, self-latching gate. Continue to keep your toddler's environment free of smoke. Keep your home and car non-smoking zones. Do not leave heavy objects or containers of hot liquids on tables with tablecloths that your toddler might pull down, like as shown in this figure. There is hot water pan on the cooking range, and the toddler is trying to skate it down, and these kind of injuries like happen every day, but we adults do not learn from such kind of injuries. These kind of injuries happen every day. Kids burn their face, kids burn their arms and everything, and facial injuries are even life threatening if edema worsens. And then there is pool safety as well. You always supervise. Child proof pools should be there. Then the child should be made to wear life jackets. Even if you want to learn them swimming, they shouldn't go to swimming without jackets in any case. Then there should be swim lessons for the children even from the very early age. Then CPR certification should be there if you are taking care of the toddlers. Then turn pan handles toward the back of the stove. Keep your toddler away from hot stoves, fireplaces, irons, curling irons, or space heaters. You remove dangling telephone wires, electrical wires, blind or drapery cords near your toddler's play or sleep areas, because they may strangulate their necks with these things. And there are certain cases when elder siblings playfully strangulated their younger siblings, and they were unable to open that strangulation wire with which they are playing, and they strangulated their younger sibling without knowing that what they are doing. Keep small appliances out of reach and place plastic plugs in electrical sockets. Keep all poisonous substances, medicines, cleaning agents, healthy and beauty aids, paints, and paint solvents locked in a safe place out of your toddler's sight and reach. Keep your medicines away from toddlers. Keep poisonous substances, paints, whatever you have at home which looks like water or which looks like juice or which look like something juicy, you keep them away, because toddlers may keep those things, put those things in mouth, and they may die within hours. Never store poisonous substances in empty jars or soda bottles, because toddlers may think that it is juice or it is water. The nutrition of toddlers: feed your toddler 3 meals and 2 or 3 planned nutritious snacks a day. Include your toddler in family meals by providing a high chair or a booster seat at table height. Make meal times pleasant and companionable. Encourage conversation. Encourage your toddler to feed herself. Toddlers learn to like foods by touching and mouthing them repeatedly. Encourage your toddler to sit while eating to avoid choking. Offer your toddler a variety of nutritious soft table foods and let her decide how much to eat. Toddlers will eat a lot one time, not much the next. Anticipate that your toddler's rate of weight gain will be slower than in the first year. So, nurturing healthy eating habits is as easy as ABC. A is avoid negative behaviors or being overly conscious during meal times. Mealtime should be relaxing, pleasant, and a fun experience for your child, because if you're feeding them rice, they may splatter the rice all over the table. They may keep throwing things all over their place. They will waste their food during the first few months of learning phase. Then they will start to learn that the food is not to be wasted. You keep counseling them, but there shouldn't be any shouting that, oh, he's throwing that thing, he's throwing this thing, you shouldn't waste rice, you shouldn't waste pulses. You have to be gentle. A kid is a kid. He will waste some things in the start, he will eat some things, but as the time passes, he or she will learn how to take care of his meals. Be there with your child. Having meals as a family creates opportunities for you to model healthy eating habits to your child. Create a routine for your child. This means setting a time for breakfast, lunch, dinner, and snack times. Once you have a routine, meal times become more relaxing for your child and for you too. Do not allow distractions during mealtime. These include watching television or playing with toys. These distractions uh, decrease the appetite of the toddlers because their minds, their smaller, growing minds, get distracted very easily with the screens or with the toys. They lose their hunger. Establish the habit of sitting in a regular place for meals. Do not let him lie down, walk, or run about while eating. Food choices are cultivated from young age. Find simple ways to increase your child's awareness of healthy and nutritious food. Keep telling them what is healthy and what is junk. Always keep telling them that this is healthy food, this is organic food, this is processed food, and this is junk food. My 3.5-year-old kid knows that pizza is a junk, knows that burger is a junk, knows that fries is a junk, knows that everything related to fast foods is a junk, and he knows that he can eat junk once fortnightly, and he should not eat junk more than once a week. He knows all of these things because we keep telling them that this is junk, this is the. He also knows that fries are junk. So he knows that if you have eaten fries in like last 7 days, you are not allowed to eat them again in within the span of 7 days. So basically you make them learn that this is junk and this is healthy, this is junk and this is healthy. Candy, you can eat candy, but then again it is junk. So you have to avoid it as much as possible, and you have to inculcate these things from the early age. And my toddler, now he's a preschooler basically, because way past 3 years, he knows everything related to foods. His nutrition aspect is way too strong than other things. He knows what is junk and what is healthy. So at 18 months, give your toddler 2 or 3 planned nutritious snacks a day. Provide snacks rich in complex carbohydrates and limit sweets and high-fat snacks. Continue encouraging your toddler to feed herself or himself with her hands or his hands or a spoon, and to drink from a cup. Encourage your toddler to experiment with foods, deciding what and how much to eat from the nutritious food that you offer. Let your toddler develop food likes and dislikes, but keep counseling regarding healthy foods and junk foods. And then there are recommended number of servings per day for children, 1 to 2 years. So you give them rice and wheat and barley and alternatives. Then whole grains should be given to the children, one serving or half serving, then fruits, vegetables. Then you also give them meat and alternatives, for example fish meat, eggs, or red meat, white meat, whatever you have at home, whatever you can afford to give them. Then you also give them milk as well. I do not agree with this 750 ml. I like to, but these are the basically guidelines by created by the American Association of Pediatricians and American Nutritionists. Although I do not personally agree with this. I think that 500 ml of milk is enough, and you need to more focus more on the solids. And milk is like, do not need to give it in 750 ml. You need to give it around 500 ml, and you need to increase solids correspondingly. Then 2 years, by 2 years, offer your child a variety of nutritious food, particularly those containing iron, and let him decide what and how much to eat. Children will eat a lot one time, not much the next time. Begin to serve your child dairy products, including milk, yogurt, and cheese. Choose the menu. Do not let your child dictate it, because if you let them dictate it, they will also go for the junk. They will always go for the junk. So you do not let them dictate it. You choose the menu, you make them learn what is healthy, what is organic, what is processed food, what is junk food, and how to avoid it. Most children will eat a considerable variety of foods if you provide them. If you inculcate healthy eating habits in them, they will eat everything. Enforce reasonable mealtime behavior, but do not force eating. So basically there is another chart for 2 year olds, 3 year olds, and also for 4 and 5 year olds. I cannot go into details, but as I have already shared my presentation with the administration, so they will, this chart will reach out to you within 2 days. So, promotion of constructive family relations and parental health. So, this is our second last topic for today. So, affection in your family, listen to and respect your toddler. Take some time for yourself and spend some individual time with your partner in front of your kids. I forgot to add that line. So basically, take some time for yourself and spend some individual time with your partner in front of your kids. Yeah, that is extremely important. Parents loving each other, parents respecting each other, parents taking care of each other in front of their kids is extremely, extremely important, because the kids blood increases fourfold, the kids mental well-being increases fourfold when there is a healthy loving environment between their parents, mother and father, at home. Because if the mother and father are bickering, if the mother and father are fighting all the time, the kids health will be devastated, especially mental health. And when the mental health gets devastated, then physical health also starts to deteriorate later. Hold and cuddle your toddler and talk with them. Give them a lot of kisses, because kissing the infants and kissing the toddlers increases their intelligence, and it promotes mental well-being, and it promotes the growth of the brain. So I have studied this a lot, and when you kiss your toddler a lot, when you kiss your infant a lot, you cuddle them, you kiss them, their intelligence increases exponentially by just cuddling and kissing. So you kiss them on their forehead, you kiss them on their head, you cuddle them, you cuddle your fingers, you move your fingers in their head whenever you are making love with them, and you just hold them tight with you. You talk softly, you talk your heart with them, whatever you want to talk with them, you just keep them close and talk softly, and it will create a healthy wave of mental well-being, and the kids will um, start to grow emotionally, they will start to grow mentally, they will start to grow, they will start to get more intelligent with time. Spend some individual time with each child in your family. Give face to face attention to each child in your family. No matter how busy you get, you have to give attention to each of your children individually as well. Create opportunities for your families to share time together, and for family members to talk and play with your toddler. The sisters of the father, the sisters of the mother. So these are like paternal aunts, maternal aunts, paternal uncles, maternal uncles. So they also should mingle with your toddler, so the toddler knows what are the family members, what are the family values, who is their family, to whom these people belong, and what is their family. So there is a family bonding. It's not just parents and mother and father, so they should bond with all of your family members as well. If you are thinking about having another baby in the next year or so, talk with the health professional about taking folic acid supplements as well. Help your toddler express such feelings as joy, anger, sadness, fear, and frustration. Acknowledge conflicts between siblings whenever possible. Attempt to resolve conflicts without taking sides. Yeah, that is extremely important. Whenever you try to resolve conflicts, you never take sides. For example, in our culture, parents take sides with the boys, and in some cultures, parents take sides with the younger siblings. So that is an extremely wrong way to do these things. So, whenever possible, attempt to resolve conflicts without taking sides. For example, if a conflict arises about a toy, the toy can be put away without putting blames on one or another kid's sibling. Do not allow hitting, biting, or other aggressive behavior. Keep family outings relatively short and simple. You do not allow aggressive behavior in your children. If they are bullying someone, you should also make clear to them that this is not allowed. You should cancel their screen time, you should cancel their play time, you can cancel their some toy, you can cancel some promise that I will give you this thing or that thing, and you then make them correct their aggressive behavior, correct their hitting behavior or biting behavior, so that they learn that there will be consequences for such behaviors. Lengthy activities tire your toddler and may lead to irritability or a temper tantrum. So if a toddler is not showing any interest in some activity, you drop that activity. Consider attending parent education classes or parent sport groups as well. You learn a lot from parent education classes, you learn a lot from parent sport groups about how to deal with the toddlers or preschoolers. Maintain or expand ties to your community through social, religious, cultural, volunteer, and recreational organization or programs. So our last topic for today is common developmental concerns in toddlers. How to deal with sibling rivalry, negativism, temper tantrums, and regression. So sibling rivalries, toddlers are normally egocentric, so basically they all care about is themselves. So bringing a new baby into the home may be quite disruptive. To minimize issues with sibling rivalry, parents should attempt to keep the toddler's routine as close to normal as possible. Spend individual time with the toddler on a daily basis. Involve the toddler in the care of the baby. So basically, you should try to minimize sibling rivalry by knowing about the child psychology. Whenever the younger sibling comes into the world, you start giving all of your attention to the elder sibling. The younger sibling, till the first 6 months or 1 years of age, has no emotional intelligence. They do not feel anything, but the elder sibling feels everything. And if you start to give extra protocol to the younger sibling in front of elder sibling, the elder siblings egocentric nature will put flame in their heart, and they will start to hate their younger sibling. So you have to understand that whenever a younger sibling comes into this world, you have to give extra attention to the elder sibling, so that there is no sibling rivalry later on in their life. Then there is negativism. It is common in the toddler period, as the toddler separates from the parent, recognizes his or her own individuality, and exerts autonomy. Negativism abounds. So basically they become negative about everything, that their parents do not love them. Even my elder son used to ask me, even sometimes he does that even to these days as well, that you do not love me, you do not care about me. So you care about your little sibling a lot, and you do your little child a lot, and you do not care about me, and you do not love me anymore. You only love my little brother and this and that. And he keeps saying that, and you always keep counseling them that this negativism is a normal developmental occurrence, and you do not scold them. You just show more and more affection, and you tell them that you are our everything, and it's not like that, and these things are normal, that you are feeling that. We understand that you are feeling these things, but this is not true, and we always love you. Deliberate defiance, and not necessarily deliberate defiance. Avoid asking yes or no questions. As the toddlers, usual response will be no. You do not ask them questions like if you whether you will do it or not, because the toddler will say no, I will not do it. So you do not create defiance in them by asking yes or no questions as well. Then temper tantrums. Temper tantrums are a natural result of the frustration that toddlers experience. The temper tantrum may be manifested as a screaming and crying fit, or a full-blown episode in which the toddler throws himself or herself on the floor, kicking, screaming, pounding, perhaps even holding the breath. Parents need to learn that their toddler's behavioral cues in order to limit activity that is frustrating. When the parents note the beginning of frustration, a friendly warning might be given. Intervening early with an activity change might prevent a tantrum. Yeah, I have tried it, and I have tried it successfully. I have learned it from their mother. So basically, she's an expert in these things. She used to teach me that if a child is going into a tantrum, you need to distract their attention from going from for before letting them go into a tantrum. So my wife taught me how to distract a child to prevent a tantrum, because when they go into a full-blown tantrum, things go down south very easily, and you have to like manage everything with so patiently and so cautiously, because it takes 5 to 10 minutes to the tantrum to get completed. So whenever a kid is going into tantrum, you need to distract them. You start telling them story, you start talking to each other loudly about someone. Oh, what happened to the Albert? What happened to Albert? Oh, he fell from the bike, he broke his nose, and this and that. And the kid stops thinking about his tantrum. Kid stops crying for a moment, and he starts listening to the parents talking to each other loudly and smiling and laughing about someone else's story, and they start hearing about someone else's story. So basically, sometimes you start telling the story to the child, but the child learns it that they start telling me a story whenever I am going into tantrum. So you have to start telling story to some other adult, and make it interesting, make it new. And the child, as they love stories, kids love stories. So basically, you start talking to some other adults and start talking loud and cheerful way, and the kid thinks, oh my God, this is some new story. So I and hang on, tantrum, you can wait. I have to listen to that story, and you then distract your children from going into full blown tantrum. But these things are not to be covered within 2 minutes. You need to experience, you need to learn these things over years. We still are learnings, we still are learners in good parenthood, basically. So regression is a very serious thing. A regression, a return to an earlier or less developed condition or way of behaving, is basically regression. Reversion to an earlier, less mature, and less adaptive emotional or mental level is regression. Some toddlers experience regression during a successful event. Example given: the birth of a sibling or hospitalization. They regress to earlier stage due to the stress or trauma. Stress in a toddler's life affects his or her ability to master new developmental tasks. During regression, the toddler may want to go back to an earlier stage, and you need a proper child psychology consult how to deal with regression. This is a very important and very lengthy topic, so I cannot cover regression in detail in this class, because it will go out of the scope of this lecture if I start going into the details of child psychology here. But regression is basically some toilet trained kid starts to poop in their clothes. That is also regression. So, toilet training, when myelinization of the spinal cord is achieved around 2 years, the toddler is capable of exercising voluntary control over the sphincters. Girls may be ready for toilet teaching earlier than boys. Toddlers are ready for the toilet teaching when bowel movements occur on a fairly regular schedule. The toddler expresses knowledge of the need to defecate or urinate. When the toddler starts telling you that I have to defecate, you keep counseling them. Then whenever he or she needs to defecate, they tell you, and after 10 to 15 days they learn that they need to tell you, and they express their knowledge of the urge to defecate or urinate. And sometimes they are able to control it, sometimes they are unable to control it. They just tell you that they are about to defecate, and they start defecating. But that is the time when you need to start pilot training. This may be through verbalization, changes in activity or gestures such as looks into or grabs diaper, squats, crosses legs, grimaces or grunts, hides behind a door or the couch. When defecating, the diaper is not always wet. This indicates the ability to hold the urine for a period of time. The toddler is willing to follow instructions. The toddler walks well alone and is able to pull down his or her own pants. So basically, these are the times when you can start toilet training of the baby. The toddlers follow caregivers to the bathroom. The toddlers climb onto the potty chair or toilet. So these are the times when you can toilet train your child. So these are some tips with the potty training. So you have to be patient. Do not make a muss about accidents, but you do not make a fuss about accidents. So if they do wet their clothes, or if they do defecate accidentally, you do not create fuss. You show affection. You yeah, make love with them, and you just keep counseling them. Do not compare your child to other children. For example, if someone else's child, if some aunt's child, or some cousin's child, or if your own some sibling's child has gotten potty trained and your children is unable to get potty trained, it's no big deal. There is time for everyone, there is difference for everyone. Some kids get potty trained early, some kids take 6 months more. Leave the potty chair where your child can see it and explain what it is for, or show them with a teddy or dolly. If you use the toilet instead of a potty, you will need a step and a trainer seat. Start gradually sitting your child on a potty or toilet around 18 months to 2 years of age. Make it part of daily routine and be as calm and relaxed as possible. Pick consistent times. Make it fun. Provide books and toys. Give lots of encouragement and praise. If they do pass urine or they do defecate in potty trainer, then you give them encouragement, you give them stickers, you give them some smaller candy or whatever, you give them rewards. Minimize stress by having as few clothes as possible to remove. Use grown-up trainer pants as well. Most but not all children are dry by the age of 3 years. So have a nice day. Thank you. That is the final part of our lecture series on maternal and child health. So basically, I tried to cover everything. I know I couldn't because this topic is so diverse. People have been writing about this thing from 1,000 years, and there have been millions of books written on these topics. So basically, these topics are so diverse, so huge. So you cannot do justice with these topics by just making a 40 minutes or 50 minutes presentation on it. But you have to cover it as much as possible and as concisely as possible. So have a nice day. Thank you.